I feel that when people want to fix a service problem, they actually only think about the software. They never thought through about the hardware of the space. My goal and my dream is to see every hospital in my country become a more friendly place. My name is Kotch Voraakhom. I'm a landscape architect. I partner with Dr. Santi, who's like the director of the hospital in Lopburi, for us to build up the guideline to actually help to really figure out in terms of the spatial structure that impact to the service of the hospital.
นะครับการที่เราทำระบบบริการให้มันดีที่สุดนะครับรวมถึงการที่เราปรับสิ่งแวดล้อมให้มันมีความเหมาะสมกับสถานการณ์แบบใหม่
When pandemic came, it's kind of stir up many existing problems to have an urgent need to be fixed in terms of how we're gonna change physical spaces to fit the new kind of service that we need in the crisis. This grant is actually make things more doable right now. We actually held the workshop with his staff and trying to get what they really need and what is their fear. When we want to fix the problem, we have to understand how they use the space and what they feel about it.
แน่นอนครับเราคงต้องออกแบบระบบบบริการแบบใหม่การใช้พื้นที่ว่างเปล่าให้คนแทนที่จะต้องไปแออัดอยู่ในพื้นที่เล็ก
ๆมีประโยชน์ค่ะเพราะเขาเจ้าหน้าที่ทุกคนมามีส่วนร่วมแล้วเขาก็รับรู้แล้วเขาก็ติดตามมีความภาคภูมิใจได้เขาได้มีโปรเซสซึ่งเขาบอกว่าไม่เคยทำที่อื่นกระบวนการแบบนี้ยังไม่ค่อยได้มีการที่จะให้เข้ามามีส่วนร่วมอย่างจริงจัง
ปกติไม่ดูเองแต่ว่าจะทุ่มๆก็ The first thing is we need a larger hospital. How can we do that? We need to rethink the waste space. And the second one, we have to rethink how we reduce the process of the service to become as minimized, as simple as possible. To reduce the risk is actually to reduce the timing that people have to spend in the hospital. How can we also fix the service through the space? How can we be more resilient or be adaptive in such an existing rigid structure of the building, of the service design to actually help us through this pandemic? What my team insert into this conversation is actually the creativity. When you are in the problem, you probably only see how you're going to fix the problem by using the same tool. But by adding more skill of landscape architects, we actually help them speak their problem louder. When we get our set of learning, we can actually offer the workshop to other hospitals and also really get those staff together with a healing experience. A public space which actually not only need in the urban dense area, but actually need in a hospital because we have 1,000 of them. Design without thinking of saving the energy, create a better healing space with green public space. I really want to push this narrative of how we fix our hospitals around the nation. Right now, people are so much concerned with a short-term solution, how we're gonna get vaccine, how we're gonna reduce the spread. The next step is how we're gonna improve a better healthcare. It's such a fundamental need.